annual efforts to engage with the World Autism Awareness Day activities. And as you all know, that World Autism Month is celebrated through the month of April, which is just round the corner. This year, the theme is Autism and Humanity. Every life has value. And it reminds us that autism is not something to be fixed. It is a different way of experiencing and interacting with the world around us. Our focus today is to explore what it takes for an autistic child or adolescent to blossom in school, moving beyond just inclusion. We have a rich expert panel here that brings lived experiences as well as professional expertise, and we look forward to learning from these perspectives. And with that, I'd like to introduce our panel. We have with us Ms. Betsy Selvam, an autistic self-advocate, a PhD scholar at the Vellore Institute of Technology, and an artist too. School was difficult for Betsy. Classroom, she says, was more like a battleground than a safe learning space where I constantly navigated confusing social rules and fought inner anxieties. By talking about her journey towards finding her voice, Betsy hopes to spark conversations about the need for more empathy and inclusion in education settings. Welcome, Betsy. We are joined. Hi there.
Thank you for having me. Yeah, thank you for having me, and I'll let you continue.
Thanks. Yeah. We are joined by Ms. Nitya and Mr. Shivakumar, who bring in the parent perspective. Nitya is a scientist at ISRO, and I think Shiva will be joining us shortly, Nitya.
Yes, ma'am. He is here with us.
Okay, yeah, there you are. Hello, Mr. Shivakumar, welcome.
Hello, ma'am.
Shiva has a background in finance, and in 2015, he decided to step away from his corporate career to support their son Sri Sankalp's development. Sri Sankalp is a chatty adolescent who has special interests in swimming and singing. Together, Nitya and Shiva will share their journey towards a sense of fulfillment and family well-being. Welcome. Dr. Suhas Chandran is the head of the Department of Child and Adolescent Psychiatry at St. John's Hospital, Bengaluru. He is also the faculty at CARET, the Center for Advanced Research in Autism and Developmental Disorders, where he leads the TYA program, a program especially for teens and young adults on the spectrum. Questions related to schooling, he says, are the ones that he answers almost every day in his busy OPD. We are really honored to have you with us, Suhas. And I know that you have jumped in straight from a workshop that you were conducting to be with us. Thank you so much and welcome.
Thank you. Thanks, Deepa. Thank you.
So, Ms. Vidya Doraiswamy is an educational interventionist and the founder of Endeavour Learning Services, Bengaluru. She leads a team of educators and therapists, a large one at that, supporting over 300 children across age groups within mainstream school settings. Endeavour has a strong presence in leading Bengaluru schools, including Chrysalis, Dean Public School, and DPS. A warm welcome to you, Vidya. I'm sure that your insights into school systems and parent-school collaborations will give us rich insights, and I look forward to hearing you.
Thank you.
And with that, I think a quick introduction about myself to those of you who have not met me. I am Deepa Bhatt Nair and the founder director of Communiverse. We are a multidisciplinary team supporting autistic individuals across the lifespan with a strong focus on caregiver empowerment. Without further ado, let's begin. So first, I thought we'll start off by understanding the school journey. As we all know that schooling is a lot more than just academics. And I want to start with Betsy to understand Looking back at your school years, what was it that made it hard to participate? And what did you find, helped you get included?
Hi, ma'am. I hope you can hear me.
Yeah.
And first, and good evening to everyone present here. Thank you for including me in this exciting panel discussion, for valuing my input enough to have me as a panel member amongst very experienced stakeholders. So I'm happy to be here and be part of this. To answer your question, yeah, I'd like to highlight the two things that you asked me. First of all, what helped me in school, uh, remembering our conversation we had earlier this week, it was hard for me to even sort of think about what a few positive things, because school was overwhelmingly a negative experience for me, and I didn't get my autism diagnosis until I was 16 years of age, and I got Asperger's syndrome as my diagnosis back then, which is now kind of outdated. And back then, I think I was really searching for empathetic adults. That was the main thing that I was searching for, and just a couple of empathetic adults were what changed my life and put me on a better path for healing and better education and better mental health. So I would highlight that as what helped me the most. First being my parents, um, and then my therapist, who gave me the diagnosis. And unfortunately, if not all of the teachers that I encountered at school were more of a negative experience, more of something that contributed to stress and all of that. So that, and then I would definitely highlight creative expression in my case. I'm also an artist beyond academics, and creative expression saved me from a lot of um, trouble, from I would say channeling my frustration into rather than channeling my frustrations in a negative way, creative expression like writing and art. That's kind of what saved me as well. So these two were primarily what saved me growing up. And what made it harder for me in school was, I'd like to highlight one point here, because of the time constraint, but I could just keep going on because it's quite a long list. But mainly the thing was social hierarchies that are usually present everywhere. But then in the particular school that I went to, there were, of course, obvious social hierarchies based on class, community, and gender. So I felt like, based on those hierarchies, I didn't understand those implicit hierarchies, and I didn't understand um, how to act according to those social hierarchies. So I think because of that, my time at school was harder. I didn't understand why I had to take everything with silent respect from teachers when they were like physically or many times verbally abusive. I didn't, so I would, talk back very loudly. Based on class and community, there were biases and discriminations, and I didn't understand those either. And I felt like I couldn't really shine, even though I felt like I had certain talents. So digesting that was very hard, and and all of this contributed to just overwhelming anxiety, crippling anxiety, and later on mild depression also. So these were things that didn't help, and also the atmosphere of fear that was used in classrooms, and Basically, I found the classroom atmosphere to be quite authoritarian, how fear was used as a means of control and all of that. So that wasn't helpful for me. So I think for me, all of this contributed to why I left mainstream schooling and felt like homeschooling was a better alternative. I
Thank
hope that answers the question.
Thank you. And that's something that, even we hear constantly in our practice that because autistic children find it hard to navigate the social norms. So when they are trying to explain their perspective in a way that is not always socially accepted, they are often misunderstood as back answering or, not being polite, which adds to the gravity of the situation. And yeah, thanks, Betsy, for that. We will come back to you. And also, I will request Smriti to share the document that you have written where you have spoken about your school experiences in depth. We will share that in the chat for anyone who would like to read more and understand better. With that, I move to Nitya and Shiva. Uh, so, what guided your decisions? I mean, Sri Sankalp was put at risk for autism even before he was 2 years of age. And, you've had your own journey. But when you were choosing schools, what was it that you kept in mind? And, how did you go about that?
Good evening, ma'am. Thank you for having us as part of this panel. We are really excited to share our experience, ma'am. Ma'am, we could identify the risk of autism for Sri Sankalp when he was just 1 month before 2 years. So from then we were taking him for therapy sessions and all. So when we planned to enroll him for school, we knew that he needs support. So we were very frank when exploring the school itself. We would tell in advance that he needs support to understand the language, everything. He had specific language impairment. So we would tell that openly. So initially we couldn't get enrollment in many of the schools. No. Like they were very clear, no, we focus on marks, so we cannot. At last we found a school where they were really very supportive and being open with what is the issue with the child. Being open with the school really helped us in one way, ma'am. Even they were very supportive in every aspect. During the process, actually, we could understand his interest in music and his interest for swimming also. Since we were very open about his problem and swimming and music would help him. So in the school also, they gave us special permission so we could before the school hours over itself, 1 hour early, we could bring him out and we could take him for swimming class and all. Just I want to insist on this point, parents should be open with the school, so even they will be able to support us. So it should be mutual. When we were exploring for the school, the prime thing we were looking was like any other parent, ma'am, safe environment and good academics. Apart from that, since he has many challenges, so we want the school who is empathetic and who can support all these whatever wherever he needs help, they should have the patience to help him. So that way we were exploring for the school and we were patient enough. We explored multiple schools and luckily we could enroll him in a school where they were really very supportive. Now he has completed his 8th standard now. But this academic load is little heavy and he is not able to take it. So recently we shifted to NIOS.
Yeah. Thank you. And, that's very insightful that, right from the beginning, you focused on his strengths and tried to give him opportunities. In fact, when I was discussing about this panel with my team and I said we should ask the panelists as to how they went about selecting, the team pulled out a very important point where they said, ma'am, do parents really have a choice in which school they're going to put the child? That they can go around selecting. And I thought that was a very valid point, and parents really have to work hard to find empathetic schools, and you were fortunate to have found one. And I know that even with that, you had your challenges, which we will go into a little later on. But
Yes.
I want to shift the focus to Vidya and ask her, what is your thought on parents? How should they go about choosing a school? And many times parents wonder which board and which will be a good fit in terms of well-being and future prospects. So please share your thoughts.
So there are so many different parameters that a parent has to consider before looking at making a choice. And there are so many different ways and perspectives are different for every parent, right? So basically, what I would suggest is make a checklist of what are the pointers that you want to tick off when you approach a school for an assessment or an intake. I taking off from Nitya, it's so right that there are this the point that I wanted to say, she pulled it right out of my mouth. The most important one I will look at is like, is it a safe environment? Is it comfortable for the child? And is it accommodative? Like, is if we want any change, is the management ready to make these changes? Would probably be the first.
I'm going to put a pause there with your sorry, but most often the parents don't get a doorway into the school to have this kind of conversation. uh, uh, you know how do they even navigate that problem? Do you?
That is changing. Yes, this was the case a couple of years back, but inclusion being largely spoken about and it being brought into practice, this is changing. And the only criteria being if what we offer does not meet the need of the child. That is the case when it becomes difficult to accommodate a child in a setting. So going with that, so I would think that. The parent always has a say. It is their choice, and we are here as facilitators. And we've taken their needs first, the child's needs first, and then the parent's need, and then we look at it. So, she rightfully said it is important for the teacher not just to be qualified, but to be warm, empathetic, and also invested in whatever work that they're doing. So, that is also a very vital thing. Then also look at management. Some managements are very proactive and they want to include children, bring them in, increase the numbers. So we also need to look at those schools. And one of the most important thing is for a child, proximity is also very important. Very far environments don't work out because the child is already tired. So while the parent is making a choice, they need to look at it. And still, I still go with the opinion that the parents are the ones who drive this, and we are here to facilitate for them. And I take all their opinions, like what Betsy spoke, what Nitya spoke. All of this is what we've been structuring into our program to ensure that at no point a parent feels not being given the choice. That's what we've been doing.
Yeah, that's I think on point in terms of the environment, which everybody's been saying, and the teachers also getting educated with specific needs of the child and how they are communicating. And the second point about proximity, because
Yes.
child cannot spend too much time just traveling and burning out in that sense when they have so much more already going on. So thank you for that, Vidya. And I would pivot to Dr. Suhas. And in terms of the mental health of autistic children who are in school, uh, and sometimes they appear all right, but there might be a lot more going on underneath. What is your thought on this?
Yeah, I mean, it's a very important question, isn't it? I mean, because for me, the one thing that I keep saying to parents and teachers is that the children who worry me the most are not the ones who are visibly struggling. The ones that really worry me are the ones who are just managing. So this is the quiet child who actually sitting through the entire school, following instructions, not creating any trouble, described as being not naughty, and then comes home and then everything falls apart. These are sort of the ones that we see all the time in the clinic as well. And the hardest part is, in fact, not say the classroom. It's usually the playground and the lunch area. A child who's able to handle max and science really perfectly, but then completely drained out by recess, etc. And of course, in when you look at from a cultural thing, you have this good student trap, very common in our context. Children who are really lavishly praised for being obedient, very quiet, very high scoring. But I see a lot of teams on the spectrum who have had very perfect report cards, but very deeply anxious, no friendships, and just about managing through schools as well. And this is especially true for, I think, for a lot of girls on the spectrum as well, especially because of the cost of masking and camouflaging that really comes in. So it's very difficult to sometimes sort of pick up signs of mental health difficulties. And of course, when you talk about mental health or think about mental health, most people imagine a child who's acting out, an aggressive child, a very defiant child, a child who's disrupting the class. I mean, I'm sure we'll cover that in the panel, but it's the ones who are coping well, like I described, who are much more quieter, easier to miss, and some of the things get actually misread. And some of the things I have noticed in the ones who are coping well are things like, a lot of over compliance and people pleasing. The child who never says no, always agrees, follows every rule to the letter, gets very, very distressed if they think that they have done something wrong. Not because they are naturally well behaved, but because they've learned that being invisible and perfect is the safer strategy. And this sort of hypervigilance gets dressed up as good behavior. And these are children who are constantly scanning the environment, what's expected of them, how to perform to the dot, etc. Another sort of common thing I see in children who cope very well, but after a point the energy gets drained, is the selective mutism or reduced communication at school. Children who are very chatty and very expressive at home, you'll hear the parents say she talks non-stop at home, but then in the school environment the child is not talking at all, and sort of it feels like the nervous system has sort of shut down that communication channel because the social demands are too much. Excessive rule following and rigidity that looks like discipline is also a problem. Children who gets very upset if a class gets cancelled, or a teacher was there, teacher is on leave, a substitute teacher comes in and gets really upset as well. And of course you have other subtler things like, child who used to put their hand up, suddenly doesn't respond to class, who used to play one-to-one with peers is now consistently alone. And you see, as coping increases, as fatigue increases, these are some of the signs that pop up, including transitions. When you have children moving from one class to the other, classroom to the playground, these are usually the environments where it sort of plays up. One thing I would definitely say is that even in these children who are coping well, sometimes the Monday problems do exist. If you see children who are consistently worse on Mondays, transition back from the weekend to the weekday is a very, very big challenge. And you'll also see in children who cope well, they get exhausted as the day progresses. So these are the children who are doing really well up until, say, the lunch break. And after the lunch break, you can actually see some sort of a crash. Yeah. So some signs that I can think of children who are actually coping well, but with time, sort of that camouflage goes away.
Yeah, I like that thought of Monday problem. I think that's something that parents often talk about. And masking, it's not easy for parents also to pick on to the fact that, it's not. It's them trying to be what they are not, and the cost it has to the nervous system. And in that regard, one example that came to my mind was a girl whom we are supporting, and the rigidity to rules that you spoke about. So in her head, the teacher should always be right. Teacher cannot make a mistake. And all of these experiences, and like you said, constantly scanning the what it does to the nervous system and the long term impact on mental health, I think is something that we all need to keep in mind. Thank you for that insight, Dr. Suhas. And with that, I move on to the second round, where I want to delve a little deeper into the challenges and when school becomes really hard. And Nitya, you mentioned about how you shifted from you found a school that was very supportive. It was an inclusive setup. It was supportive, and yet after class 8, you have taken the decision to homeschool him. So I would like you to share what brought about that decision.
Yes, ma'am. Ma'am, that was really a tough decision for us to take. From the beginning, the school is very supportive, and they were like everything they would use to share, even small whatever he throws tantrum at school, everything they would accommodate, but they would keep us informed everything, and they were very supportive. But he was also enjoying the school till his fourth standard, fifth standard. After that, slowly we could see that he started resisting. We thought it will be like usually every child will have some sort of rigidity. They don't like something, so he doesn't want to school. So we tried to explain him, and we were convincing him and making him to go to school. and we were parallelly taking the therapy sessions also. But then, we forgot one thing, ma'am. Through the process, he is also evolving, and we should start listening to him also. That many times we forget. We always think he is learning, he is still learning. We forget to listen to what he tries to tell. He had been expressing it in one or other way, and we would link it to something which happened recently in the school, either friends making fun of him or something happened in the school, and that way we would try to relate. So that is the reason he is not going, and we will try to give him some okay, you go and come, then we will make you do this, whichever he likes. We would try to bribe him. That way we were making it, and poor fellow, he would succumb to that, and he was going at one point when he was in eighth standard. He was very open, ma'am. One day he started telling. Actually, these all is evolving only, ma'am. This therapy sessions, of course, I should here thank to Feba, ma'am, and to you too, ma'am. Actually, you gave us a lot of insight about that. After the therapy sessions and all, he was becoming more vocal, and he was not getting carried away with emotion. He was able to express what he wanted. One day he told, "It's getting difficult for me. I cannot continue ICSE. Please help me. How would I come out of this? You have to help me." He said that. When that is when we understood we should listen to him also. Though we were feeling guilty that we missed to listen, but okay, at that point, at least we started listening to him. In fact, during his therapy sessions with Communiverse, even we were part of parents we would sit as part of the therapy session. Many things we could learn from him, from the sessions. We started listening to him. We understood what he is telling is true. It is not just to get away from the situation. He is not telling to get away from. We started believing him, and we started listening to him. That is really the turning point. So then we thought, okay, let him do what he likes in his own way. Thereafter, we explored. We had discussion with you and discussion with his school counselor, and also ultimately we explored all the options, and we arrived at NIOS, ma'am. So here we have lot of flexibility where he will be able to do the subjects in his own pace without much pressure, also doing all the activity which he is really interested. Of late, recently in 8th standard, he has to discontinue his swimming class and singing just because he didn't have time to complete his regular class notes, ma'am, which I felt he was feeling so bad that he couldn't do what he wanted. Then he's losing his childhood also without doing what he likes, which we also felt bad. We shouldn't have put that pressure. So at least we thought, at least now we will take and give him the choice, like let him do in his own way. So we opted for NIOS, and we have registered now. This is totally a new domain for us, but we have thought the best thing for him, and we have started. Hope things will go well, ma'am. Thank you.
I think definitely my best wishes, and I'm sure things will go well. Couple of things that before I move on, I just wanted to share that as a young therapist, I must say that I've also made that mistake of thinking, we should do everything possible to set this right. We just have to set this right. Let us do this. Let us do that. But as I have become wiser and I have heard other people, and I have realized that, what today we are seeing, that it is not something that we have to fix and make right. Because when we try to do that, we are robbing the child of his childhood and his joy. So I think that's a very powerful message coming from you. And in our earlier conversation, I liked what you said, that in the early years, you missed many things as a family. And that is what you have rediscovered now. And, I think that's a very strong path and journey that you have taken. And
No, ma'am,
thank you.
right, yes. This one point, I thank you, ma'am, for reminding. I just wanted to tell this for young parents over there. Please don't miss any small locations and all. Please enjoy your life too. That is very important. Later, that missing of those joyous moments will indirectly put pressure on the child. We missed so many things and we are trying to do, and the child is not improving. That pressure we will try to put on the children. Please don't do that. It's one request from my side.
Thank you. And with that, I want to move to you, Dr. Suhas. Many times children say, I have a stomach pain, I have headache. And like Nitya said, But we can't. It's not wrong. Parents do start thinking that the child is just making excuses, while there may be a lot more going on. And in the erstwhile Asperger's, we also know of the curve, where there is a rumbling, and if we can identify those signs, as you were mentioning previously also. So, can you help parents identify the early signs of distress when they can step in? It would be really nice.
Yeah, again, a very important question. And if I have to be very honest, it's something that even clinicians very struggle with, to be able to say the difference between just distress and, say, a disorder. I mean, a normal adjustment in one sense would look like a child who's a little unsettled for a few weeks, something changes. You have a new school, new class, new teacher. There might be some clinginess, some reluctance, but over time, with support, it will sort of settle, and the trajectory is towards concern. I mean, towards comfort. But the real concern is when the trajectory is the other way. So you have a child who seemed okay initially, then slowly starts withdrawing, or the difficulties are not reducing despite some reassurance and support. That is a big red flag. I mean, this word that you use, rumbling, is very interesting. I've not heard it very often, but I mean, if you're looking at it in terms of stages, I would say there are three stages. One is that you have subtle signs. You have the child who's perhaps taking a little more longer to get ready in the morning, a little more irritable after school, stop talking about school altogether. You might see this then escalate into stage two as, a lot of meltdowns, or the opposite also sometimes, where you have a complete withdrawal. Sleep gets affected, appetite gets affected. A child who's verbal perhaps might start saying things like, I'm stupid, nobody likes me. And so a lot of those baseline symptoms of autism itself include repetitive behaviors might get worse, sensory issues that had settled sort of might reappear and might get worse, all of the time saying that the body's stress response is sort of showing up. And the third stage perhaps is all of this remains unaddressed and you reach a crisis point. You see school refusal, anxiety, depression, sometimes self-injurious behavior as well. But most times these signs are there much earlier. I think earlier in the previous question, I spoke to you about the Monday sort of patterns and the last hour. Here, the two patterns that should immediately set off alarm bells is the Sunday evening pattern. You'll see a child who consistently becomes distressed, irritable, or physically unwell just on Sunday evening or early Monday morning. That's unlikely to be a coincidence if it keeps happening. That's anticipatory anxiety. Sort of the body is telling what the mouth, the child can't. And you also have the second pattern, which is the holiday pattern. So a child who's completely different during a school break, Christmas vacation, summer vacation, Diwali holidays, a lot more happier, calmer, more themselves, and then regresses the moment school restarts. That is very important information. And I don't think we should just dismiss that off, because every child, of course, prefers holidays, but a dramatic personality shift between the school time and the holidays is one sign. And like I was telling you earlier, the body sometimes speaks for the words can't. So a lot of, like you were saying about the stomach ache, you'll see headaches, you'll see teeth grinding, you'll see nail biting, a lot of stimming behavior that continues to happen. I think one practical framework that I would leave you all with is what we use, three C's. Three C's is change, clusters, and chronicity. So a single change in behavior might not mean anything. But when you see a cluster of changes like sleep, appetite also a problem, mood is also a problem, social withdrawal also a problem, happening synchronously, happening together, and these are changes that are persisting chronically over weeks rather than days, that's when I think you should be reaching for support. And most times I really do believe that the parents know best. I really feel that the teachers should trust their gut, because most times they're right. More than all these symptoms that I laid out, very technical stuff, sometimes a teacher and a parent just knows that this has crossed a fine line between just being an adjustment difficulty into something far more bigger as well. And I would always encourage and the teachers to trust their gut as well, and the parents, and go with that as well.
Yeah, that's very powerful. Trust your gut. Very powerful. And something that I also remembered is many a times when children start school for the first time, they are picture perfect in school. The moment they come home, all hell breaks loose, and parents come rushing to us, has he regressed? Has he regressed? But as you're saying, it's the nervous system trying to calibrate again in a safe environment of the home. So that, and also remembered what you had shared with me, Betsy, about how I think much before you got diagnosed with post-traumatic stress disorder, because of which you actually pulled out of school, and you talk about it quite openly. You did have the signs of, losing appetite, not sleeping too well, and early signs of depression, which I think in your case did get picked up until a little later, right? So these are things that parents should keep in mind, and in the best interest of their children. Uh, and with that, I want to segue to you, Vidya, uh, to talk about something which many parents, and struggle with. So many a times, children will demonstrate knowledge at home. They will do a lot more at home, and they don't do the same at school. And it's hard for teachers to understand sometimes. And if they don't demonstrate competence, how are teachers going to understand the child? And parents have this difficulty of, how do we tell the school, you know how do we communicate without getting confrontational and have a collaborative approach to this?
So, very nice question. Basically, I see this engagement between the child, the parent, and the facilitators as something which is like a relationship. And like every relationship, this must be based on mutual trust and a belief that we have the best interest of the child at heart. So once this premise is set, basically what happens is then the whole equation becomes, the whole narrative becomes positive and much more collaborative, and it sets the whole tone. So we are able to share ideas through. If we are stuck somewhere, we're able to openly ask the parents. Similarly, the parents are able to share and ask us. Very simply done. These are there are no challenges. The parents can always come up and say, "This is what I observe at home." And obviously, these are two different environments. One being more formal, and other one being much more comfortable and something that that the child is used to. So we definitely factor that in, that there could be areas of strength that we notice at home more than at school, and there will be areas of strength that we notice more in school and not at home. So this sort of a back and forth must happen. One simple example is like a pen to paper task is always very challenging for a child. So if a child doesn't perform well, we always call the parent and say, "Can we do the same thing at home?" So that we get a right picture of whether the concept understanding has happened or not. And that way we are able to share ideas to say, okay, hey, I work this way and it works better for my child. Or, like to say, can we tweak it this way? Or the therapist is saying this. So we're able to bring those thoughts in. And there is no, I think there should be no obstacle or there should be no challenge in us sharing these ideas, because ultimately the end point is to make sure that the child benefits from the sharing of ideas and thoughts, be it another facilitator, whoever it is. This becomes engaging for the child as well when we work together.
Right.
Did I answer the question, Deepa, or should you want me to?
I did have a follow up. So when you engage with school managements, let's say you are looking at setting up a support system in a particular school, and how do those conversations go? Are all managements open to inclusion, or do you find that there are roadblocks? uh, just quickly, two things: if there are roadblocks, what do you do?
There are roadblocks, and most times the roadblocks are from parents themselves. It's the other parents who are the roadblocks most times. But these are not something which is like difficult to navigate. It is possible with an open conversation. We are able to bring things together. But where we are stuck in most times is the transport, bringing the children, because it is a closed environment, and with so many children and not so many support staff being there, it becomes a challenge. Those are ones that we are not able to find a solution as yet. We're still working on it, but most managements are open to suggestions and they accommodate our needs. So we are able to navigate most of them, is what I would say.
Thank you. Thanks.
That's a very positive thing.
Yes. So, and with that, I move into our round on, building a voice, helping the autistic adolescent. In fact, right from the day one, I would say, building the child's voice to understand himself or herself and to ask for what they need. So let's look at that a little deeper. And I want to start with Betsy. So, Betsy, your journey was not really the conventional path. Like you said, you were in class 10 and then you did 11th and 12th from home, and then you went back to school. In fact, I mean, college, you actually went into a hostel, right? So, I really would like you to share how did you find the strengths and how did you build your voice?
Um, I think I'd like to talk about 3 points here. First of all, it all started at the age of 15 for me when the anxiety was just too much, and like Dr. Suhas said, it was that case of putting on a perfect mask in school and then coming home and just it breaks completely, and then the whole emotional and mental toll it takes on you, masking, and then bearing a lot of stress, and not knowing why you don't fit in, that social alienation, etc. It sort of builds on you. So uh, first of all, I would say that going to therapy as the first step and getting the diagnosis was life changing. For me, it was a very positive thing. For me, and later on, I learned as I read more about autistic people that getting the diagnosis or that diagnosis point is often a positive point in life. It's a life changing time because you feel like the jigsaw pieces sort of fall into place, and they finally help you understand why you never fit in, why you couldn't, um, you know, uh, be the way that other children were perhaps, and why you were so different, and why many things didn't make sense to you, and so that really helps. And so it's a point of sense making. People really do take stock of their life until that moment, and for me too it was the same thing. I felt like I was revisiting everything since early childhood, every single um, stage where everyone kept telling me that I was different, or this is off, or why do you do things this way? So everyone sort of does it this way, but you're doing it in a different way. Yeah. uh,
I just interrupt you for a minute. I remembered something very powerful that you had shared with me about how, unlike many others, you have a strong visual memory of any in episode in school that has not gone well for you. And I think that is something that parents should know.
Yeah, it can be a double-edged sword. It really helps when it comes to academics and creativity and all that, but when it comes to everyday life, it made my life kind of hellish for a while because as a young person, I remembered everything in stark detail, and I still do right now. So I still remember every single thing that went wrong in school, and I used to agonize over it to the point that I couldn't sleep at night. I would toss and turn all night, and it would become extremely traumatizing. And you understand how it sort of builds and builds. It's like a snowball effect. It builds and builds and builds until it you hit a breaking point. And so that's what happened to me at the age of 15. And getting the right support was just it was life changing, and I was incredibly lucky because I didn't have to go through a lot of misdiagnoses and getting the wrong labels as many others go through. Because as you know, for girls at least, I understand that autism presents a little differently because it's more subtle. It's harder to spot because of the masking element, and so many girls get diagnosed as bipolar, or with an alternative diagnosis that leads you somewhere else, and then they get medicated for that, and then it usually doesn't end up helping them and so you have to trudge through many misdiagnoses before you get something that fits you correctly. But I didn't have to go through that. I got autism right away, and it really made sense. And I could completely understand everything, and I immediately started reading up on it. And because I'm a big reader and I love reading, I couldn't stop myself from digging into all of this and reading up anything I could get my hands on. And so I would credit my psychologist, who was my only psychologist since then, for pinning it down right away and for telling me, this is what happened, and also for nurturing a positive sense of autistic identity in me. I didn't feel like it was a load or a burdensome thing. I learned to embrace it, and I learned to see the strengths in it. So it was more of a strengths based approach that we took. And secondly, I would say a supportive family. Parents, of course, are the most important. And for me, again, I was lucky. My parents listened to me when I said I didn't want to go back to mainstream school. It was just horrifying. And so after 10th grade, I left mainstream schooling, and I did my own research, and I spoke to a few of my friends, and through friends, actually, I came to know about open schooling, NIOS, and that seemed to be the only alternative for me at that point. And many people did tell me not to go into it. They thought it would be restrictive, that it would close many doors for me, etc. But I just knew that I had to take it, and that was the only alternative for me, because there was no other alternative to NIOS that I knew at the time. And so going into NIOS, it gave me that freedom to educate myself. Again, under NIOS, you do get tutors and teachers and a study center, etc. But I chose to just educate myself. As you understand, I was traumatized by teachers by this point. So I took it all on myself, and it was an exercise of self discipline, and a lot of self education. So I finished the rest of my high school that way. And so I would say the next point is, family, a supportive family that listens to you, as Ms. Nitya said, right? Like, listening to the autistic person is paramount, because they're the ones going through the experience. They're the ones who are living in this world. And finally, I would say the freedom to choose what I wanted to do next. I was I have to credit my family for this, because again, they were supportive in this, but I also knew what I wanted to do next. I knew I wanted to maybe go back to college, mainstream college, after this, because in those 2 years I had grown so much, and I painted and I wrote and I sent my stuff out to publications and all of that, and it was such a huge uh, learning experience that can't be understated. And so I had that freedom to choose. And also, maybe this is also another crucial point to note, but I don't know. In my case, solitude was a very important thing. I'm someone who values solitude a lot. So during those 2 years, I was mostly with myself. I didn't have a lot of uh, I left school, and I didn't really keep in touch with my school friends. I was completely focused on the education and the creative stuff, and I was mostly by myself, and mostly I would just be surrounded by my parents, and then my grandmother. So it was just the family setting and me. And so in that solitude, there was a lot of growth, just immense growth uh, that I can't fully explain in words. But I would say that uh, as opposed to isolation, which has a negative connotation, solitude is a positive thing. And I think that rather than all the time, what tends to happen is uh, children, whether they're neurodivergent or not, they have so much to do these days. Like it's class after class after class. Uh, Being bored for some time or having solitude and time to think and time to contemplate what you want to do next, what your interests are just as valid and important. So for me, these were things that helped me grow and reconnect with my strengths and put me back on the right track, I would say. And yeah, that's what happened. Thank you for that question.
Yeah, and a big salute to you, Betsy, and your family. The growth that we are seeing here, we are evidencing it today. And I'm going to request my co host, Smriti, to share some of your artwork in the chat for the others to see as well. Uh, Before I move on, I want to emphasize that because I hear it very often from parents who say, स्कूल से आके वो अपने से ही बैठा रहता है, कुछ नहीं करता है, अकेले अकेले बैठता है. So I think that is also the kind of that solitude that the nervous system also needs in order to be able to regroup. And you needed those 2 years to be able to regroup and come back stronger. And I think thank you for that share. And with that, I want to move to you, Nitya and Shiva. Uh, Two things. Number one, he started advocating for himself, and you also kind of created an environment where he could speak up. Yeah. So for other parents listening to you, just two things that you think would enable this ecosystem to develop first. And taking up from the chat, some people want to know that when you took the decision for NIOS, was Sri Sankalp also a part of that decision making?
Yes, ma'am. Your question had a two-part, ma'am. Whether NIOS, how he vocalized, my son vocalized, and how you took the decision. There were two parts, ma'am. So first thing is, my son, though he was undergoing therapy, recently only 2 years back only we could get connected with Communiverse, ma'am. Here I would like to mention about Dr. Meera from Nimhans. She is the one initially when he was 2 years. She was the one who diagnosed him of autism, and she is the one who explained us what we have to do as a parent, what is our role, and what exactly is our, we were totally unaware that time. So she was the one who guided us until today. Anytime we reach a dead end, we go to her for seeking for the guidance. She was the one who guides us every time, and she is a reason for getting connected with Communiverse also, ma'am. So I wish to thank her at this moment. And getting connected with Communiverse really changed Sri Sankalp's life, ma'am. Actually, he was going for therapy sessions earlier also, but after that, Febakoshi ma'am really helped us and helped him to make it like earlier when he used to get stressed out, he would scream or he would throw tantrums. Like he started expressing very clearly what he wanted, ma'am. So that part started only. That is a. I should salute Communiverse for their service, ma'am. Really, that helped him be more vocal. He started explaining every small things happening, and he would make jokes also. So that is the best part we could enjoy. So that he would express everything, ma'am. So that made him vocalize more. For us to listen to what he said is because of one instant, ma'am. Like we could get interaction with one neurodivergent adult through Communiverse. So during that interaction, we understood really what he really goes through and what we need to listen to him. Like in what, like we should keep our mind open. We should not have assumptions when he is talking. Generally, we assume maybe for this reason he is speaking like that. We should not have any pre-assumptions. We should listen to him with open-minded and we should believe him. She gave one very valid point, ma'am. Like when the child knows at home, he is supported by the parents. Like parents believe in him. If their child feels that confidence, they will become much more stronger. That made us realize that we should start listening to him what he wants to tell.
What does that look like? How does that believing in your child look like? What changes did it bring about in you?
Yes,
That
ma'am. So thereafter only we started listening to whatever he said, like, and we would never stop him, even though sometimes we feel that what he speak is not in sync with the situation. But we started listening to him thereafter, ma'am. So that is when he started expressing, I am finding it difficult. Amma, why don't you help me to overcome this? I'm not able to study this. I don't want this. So here the decision making moving to NIOS, not purely in discussion with Sri Sankal. Like you had put that question also. There is a question in the chat. He was telling he doesn't want the existing system. That he was very clear. He was expressing that. We thought we should help him to come up with one new curriculum, which may help him to do in his own way. So that is when we started exploring and he learned about NIOS. Though selecting NIOS is Sri Sankalp was not part of the decision. Ma'am. He was very clear he don't want the existing system. So NIOS was our decision. We tried to explain him. This would help you to go little slowly in your own way. Hope he understood. Maybe slowly he may understand. Ma'am. But that decision of NIOS was parents. We only took the decision in consultation with his teachers, with you also. Sometime we had discussed about it, ma'am. So that was the decision. Actually, I should thank here Betsy. Though it is painful to listen the struggles what she has gone through, but how the transformation, salute to her, ma'am. She is able to express things so well, which even I will not be able to express. So good she is. All the best, Betsy. Thank you. Thank you, ma'am.
Thank you. I know it is not easy, but we learn a lot from hearing from each one of you, and it influences our work with so many others.
8 बजे के आसपास या फिर घर पे बना ले
I just want to take just a second for the professionals out here. So, our work has been influenced a lot by Kelly Mahaler's social thinking, and also not Kelly Mahler, sorry. Kelly Mahler is introspection, and Garcia Winner's social thinking. So, any young professional who wants to read up more, I thought I'll put it out there. And with that, I want to move to Dr. Suhas. And increasing from everybody, we are hearing that a supportive environment at home is what makes all the difference. So, what can parents do in everyday life to support the children at home?
Right. I must say that I think Betsy has answered that question so emphatically, and I think Nitya and Shiva have also done that so well. I mean, it's amazing to hear that. Absolutely. I'll try and just add a few points, or perhaps in this case, consolidate what they said. I do agree with what both of you said in terms of the home as such. I think the home should become not a second school. A lot of times the evenings are filled with tuitions and therapies, and I'll use a word that you used of the nervous system. There's no time for the nervous system to recover. You have school from 8 to 3, you have tuitions from 4 to 6, you have therapies till 8, and then you wonder why the child is melting down at 9 p.m. So one thing we often tell the parents is your most important intervention and a very good protective factor is to allow for the child to do nothing for 30 to 45 minutes. So this is nothing here means no screens being pushed at them, no questions about school, no demands, just decompression. And I think that is very, very good recovery. And I think at home, generally for parents also, sometimes it can be a very isolating experience for parents. And I think it's very nice to have a community. So parents who connect with other parents, because so many times isolated parents just with the exhaustion end up making some decisions that are not great. And I think connected parents, there's a lot of evidence for that, just not my intuitive sense of it or my clinical experience. There's a lot of scientific evidence to say parents who are better connected share strategies, who validate each other, they're able to catch things that professionals miss, because honestly it's parents who are in the trenches every day, and I think that is a very, very big protective factor to connect with other parents. I think another sort of two underutilized resources at home are the siblings and the grandparents. And I think if you're sharing space and the child space is also shared with the parent and with the grandparent and the sibling, talking to them and getting them on board and getting them involved, I think sometimes can make a big difference. And some, of course, some of them might carry some guilt of being a little frustrated, not being able to understand. But I think if you are able to have that conversations with them, I think it makes a very big difference. I think, Deepa, you asked only about home, but I do think protective factors should extend beyond the home into school as well. I'm not sure Vidya is going to answer that, but I'll just add to my two thoughts on that is that I really feel that in school also, and I say that at home as well, to have one reliable, safe adult makes a very big difference. This is an adult at school or at home who the child trusts, who they know that they can go to when things get overwhelming. And it doesn't have to be a trained counselor all the time. It could be sometimes at school a librarian, it could be a teacher, it could be a retired teacher, it could be somebody who moved away. But I do think that what matters with the adults is the consistency and the warmth. And I think we should not leave that to chance, because sometimes you're hoping for that to happen, but I think we should deliberately create chances for this to happen. And of course, in terms of, the generally, I think in terms of educating the peers at school, it's not often talk about, we speak a lot about training parents, training teachers, but I think it's preparing the classmates also that makes a very big difference. Because sometimes I feel that the reality is that a lot of the child's daily experience is shaped more by their peers than by the parent or by the teacher. And sometimes when classmates itself understand neurodiversity, I really think it makes a big difference. And very frankly, I think neurotypical children benefit from this too, more than we actually accommodate. I think, and as a clinician, I must make this point. I do think that the clinical interventions also are a very good protective factor, and for parents to know that is important, because it's important to intervene early and light, not late and heavy. A lot of times, families come to us in crisis, whether it's school refusal, severe anxiety, and most times we notice that something was off in the first few years, and they felt the child would grow out of it. A 30-minute conversation with the clinician when the child is 6 or 7 can actually prevent 6 months of intensive intervention when the child is 12. And I think that's very, very important. I'll close with a few points, and I'll take off from what Betsy so beautifully described in her sense that I think teaching the child, as parents, teaching the child to know themselves is very important. And I think if the child knows what sensory environments overwhelm them, what calms them down, what do you need from a teacher to learn well, what does a good friendship look like for you, and I think when they can actually know this, a child who understands themselves, that self knowledge, I feel, is the single most portable protective factor, because it travels with the child. I call it portable because it travels with the child no matter where the child goes, whether it's school, whether it's home, a new geographical relocation, a new environment, every life stage also. And of course, like Betsy also said, it's the diagnostic disclosure. When does the child be told that the child does have autism? I think naming that diagnosis when it's there is very important, and it should be done well. It should be developmentally timed, it should be framed as self knowledge, it should always be connected to strengths as well as challenges, I feel. And I think it helps knowing that I'm not deficient in any way, but my brain works differently, and I know, and now I know what I need. And I think that reframing is profoundly protective. A couple of other points is, I do think that we all sometimes, and I say that with myself as well, clinicians and therapists and professionals, sometimes we all work in our own silos, and parents find it very hard. But a huge protective factor is if when everybody involved with the child can actually talk to each other and get on the same page as well. And it doesn't require elaborate system. It's just the intent that matters, and perhaps now a WhatsApp group, for example. So I think the goal overall is to not to build a very stress-free life for these children. I really do think that we can't, and I think we shouldn't try. I think the world is going to be very demanding, unpredictable sometimes, and like Betsy was saying, sometimes very unfair. And the goal, but then, is to just build scaffolding at home, at school, and clinically, so that when the stress really comes in, the child has enough self-understanding, enough safe people around, and enough coping strategies to actually navigate all this without breaking. Yeah. Thanks.
That is really powerful, and you packed in a lot in there, and many takeaways for us. Thanks a lot, Dr. Suhas. Um, and yeah, now we're kind of almost going on time, but a little. I want to leave some room open for discussion as well. So, Vidya, I'm going to just ask you for maybe 3 things that schools can do. So, from what can a school do if they have a neurodivergent child, an autistic child in their school?
So I'm going to take on from where Dr. Suhas was. He made very, very good points. We started working with children 15 years back with the neurotypical children in the classroom to sensitize them to how to work with. So that started. So that's something that we weaved into our program. So working with the children, making the classrooms accommodative, making the teachers sensitizing them, bringing in attitudinal changes. This we started. That's one point. Another one is we work with the community as well, because one space that we didn't speak about is the mall and the parks and wherever else we go is also a space where the child needs to be made welcome, valued, and respected. For that reason, we also do many programs to actually bring these bring pointers to the community, people in the community, to the immediate community. So that's something we do as well. So these are areas that we began working with because these are required. And another point that is so nice, which I would want to pick on, is the word scaffolding that Dr. Su has used. And I did see a message about what about shadow teachers in the classroom. So just to make the point clear, scaffolding is something which supports the child and helps them grow out of it eventually. But a shadow teacher is something like a crutch where you become more and more dependent, and that's one reason why I, for a fact, don't support that. So the difference between the scaffolding and crutch is something that all parents should understand, and every remediation should be something which is aimed at being a scaffolding rather than a crutch where you're actually getting a child out of it. Right. So, yeah. So, did I get to your point, Deepa, or did I go all the way?
Absolutely on point. Thank you very much. And with that, I'm just going to just quickly read through a few points that I noted down from everybody's inputs today, and then we'll open up because in the Google Forms we got some questions that we would like to put it across to the panelists. So I think what we are hearing is that the family and has a very important role. Believe in your child and create environments where your child can be open with you. Build relationships with the school that you are going to, and be open with the school. We connect with other parents. Building those networks definitely will strengthen you further. If there are signs of distress, recognize them early. And Dr. Suha said, listen to your gut and intervene as early. Don't wait for it to become a big snowball, like how Betsy said. Solitude is a positive thing, not isolation, but solitude, and it should be respected. And I think the very powerful point on portable protective factors help your child to understand themselves and speak up for what they need and build what it into their system so they carry it with them through life. So there was a lot, but just wanted to quickly summarize this and then open it up to the questions. There was one on academic readiness versus emotional readiness. And that's a question that I wanted to put to Dr. Suhas and, get your insights on that, Dr. Suhas.
Sorry, maybe the person who asked the question, if you permit, can unmute and ask it because the context of the question would matter.
Yes. Nirupama, are you there? Would you like to put it across?
Yeah. Can you hear me?
Yeah, we can hear you.
Yeah. So as interventionists, we largely focus on school readiness, where we're focusing on academic aspects, communication. We often don't look at the emotional side of the child. A lot of focus goes into that. So I just wanted your thoughts on it, because we need to rethink about this as therapists.
Could you hear? Basically, she's saying that when we prepare a child for school, a lot of focus goes into academics and getting the child academically ready to enter school. But what is the emotional readiness? Nirupama, I hope, correct me if I'm wrong.
A little tricky, because the problem is that our entire school system is sort of based on academic readiness as this gatekeeper. Admissions are based on it, promotions are based on it. Somebody spoke about streaming is based on it, and this emotional readiness, which perhaps may be the ability to regulate, cope with frustration, all of that is treated like one nice to have thing. It's not a must have thing. People treat it like, oh, you have it, it's good, but it's not a must. It's not a prerequisite, if you know what I mean. No, but you will see as the grade goes higher and higher, the need for the emotional readiness far outweighs the academic readiness. I mean, it's a no. I mean, it's very obvious. You will see. I mean, you'll see a lot of times that the child is simultaneously in the right place academically, but in the wrong place emotionally. And the academics looks fine, but in terms of things falling apart at home, in terms of the mood, in terms of the exhaustion that it takes a deep toll on the child as well. If you ask me for a solution, I don't have one actually. But what I would love to see and is sort of a dual readiness assessment system. Before we put a child in a school, move them, say, to a next grade, or decide on mainstream versus special education, we should really be asking two questions, not that one traditional question. So, first, can this child handle academic demands? Traditional question. Second, equally importantly, can this child handle the emotional, sensory, and social demands of this particular environment? If the answer to the second question is no, then it doesn't matter how smart or how big an IQ that the child has. I really feel pleasing a child based on IQ alone is sending someone on a trek just because they have big legs and strong legs without really checking if they have the right shoes, in one sense. Sorry, a bad analogy, but that's what comes to mind. So I don't think, as parents, one thing is don't let anyone rush your child into an environment they're not emotionally ready for just because they're bright enough. A lot of people say he's so bright or she's so bright. Academic skills can always be built, but a child who has been emotionally overwhelmed, who has developed school anxiety, like Betsy was saying, who was sort of symbolized that school is now a symbol of a place of suffering. That damage can take years to undo. So protect that emotional foundation first, protect it at all cost. The academics will follow. I have never in all my years of experience seen a child whose life was ruined because they started school 1 year late, or but I've seen many children whose mental health was really ruined because they've started academic things far more heavily, far too prematurely as well. Yeah, I hope I've answered that question.
Brilliantly. That analogy is going to stay with me. And I think that's so powerful that, it's very easy to just look at the academics and, that understanding that if the foundational emotional readiness is not there, then we have a big decision to make. And thank you for that, Dr. Suhas. And with that, and
Sorry.
my co-host Smriti, would you like to, take on from here and let us know what the next question is?
Yes, thank you so much. And I would just, it was such a beautiful panel today where, we have slowly shifted the conversation now. We are not just, sitting there thinking about, okay, why is my child not talking, but more moving towards, like changing how we are listening to them, wanting to understand them and support them fully. So I think this is a very good mark of how things have started changing in the way where the therapists are working, where the parents have started accepting their children, and the school is also coming halfway trying to accept the students and support them in a very, supported, scaffolded environment. So I think this is a great change that we are seeing slowly, but yes, we are definitely moving in that direction. Now I'll take up some questions.
While you do that, Vidya, I think wanted to say something. Vidya, sorry, I missed that. Did you want to say something?
So I just wanted to say about this whole thing about academic readiness and emotional readiness. Normally, I would suggest that as professional, what we should do is like look at that as part of your one of the domains that we work on. And if you have the emotional readiness and you have your cognitive skills, then the academic skills come on automatically. So the focus is in schools, the curriculum should incorporate this into the teaching. And even if a child is not emotionally ready, we have the tools to figure that out, to say that where do you stand, what are your strengths in this area, and start working. So the curriculum should actually incorporate this as one of the key areas that they work with, and academics should be taking a back seat. And when that happens, I think we would literally make sure that we bridge this gap between the emotional readiness and the academic readiness. That's the point I wanted to make.
Yeah,
Thanks.
no, that years of experience shows. Thank you. So, yeah, thank you for that. And yes, Smriti, I actually.
Some of the questions have been already taken up earlier. So I'm just waiting the group to get more interactive, and we would love to hear from all of y'all.
So if there are, I want to call in Miss Nazli Shah, who has just put in a comment, and I know who's the headmistress of a school. I'd love to hear your perspectives on this, Nazli.
Hi, everybody. Uh, can you all hear me?
Yes, we can hear you.
All right. So very interactive. I really love the analogy that you gave us, and we also face a lot of problems at school with regards to understanding autistic children. And some of the things you came up with, analogies that came up with, are very true. I don't think parents have much of a choice in terms of how they select a school. But we as educators have a choice as to how we treat the children who are autistic. So if we get a lot of parents do give us certificates saying that the child has been diagnosed with autism, but we as a regular educators do not know how to handle such children, and sometimes they are accompanied by shadow teachers. But I heard uh, the doctor there saying that yes, it becomes a crutch. So now, when do we get out of the shadow teacher accompanying the child? Like, say, class 1, we have a child, so we have a shadow teacher accompanying the child. When do we remove that shadow teacher? How do we know that the child can figure himself or herself out of whatever grade he is in? How do we handle that?
Vidya, would you like to take that?
Sure. So this is what I spoke about. So I actually would not even recommend a shadow teacher. So we need to look at the whole behavior presentation in a positive educational way. So what we do is we work on them first before we even bring them into. So we have a smaller group. What I would advise is look at smaller group settings where a child's behavior can be handled and the learning plan can be customized to suit their needs. So the need for an external hand, which is like which in most cases the standby supervision, is not required. So we start off because there's no weaning away, because that becomes more like because with some, I would say, in practice, I have seen them being weaned off at grade 4, grade 5, and that's a decision taken by the parents and not necessarily something which is easy on the child. Again, it's like taking some support system completely away from the child at a point where they require it because the curriculum gets tough at that point. So I would say, why give them something which you're going to remove at a later stage? Let's work with their strengths and make them resilient and make them ready to face the the classroom demands that are being met. And these days, the way the teach is so immersive, in sense it's more visual and auditory, that the interest is kindled and maintained, and all it requires is for the behavior to be handled before we bring them in, and that gets simpler with just a child growing up to meet the challenge as opposed to someone else supporting them.
Yeah, I think it's as a nation, that's what the government is also trying to do, build systems. So, we are not just saying we are inclusive, but we have systems and processes in place to support the children that we have. And that I'm thinking is going to be an evolution, and it's going to be something that we all together will work towards that. And thanks a lot to both Vidya and Nazli for this. And how much time do we have? We do have another 10 minutes. I'm patting myself and the panelists that we've kind of managed to finish with enough time. And that's always a struggle that I personally have. And I'm going to take a moment to just, heave a sigh of relief. And Smriti, can we have the next question?
Yes. So we have a parent asking, When do we opt for NIOS?
So yeah, Vidya, you are in high demand today.
So there's one part of the question that I kind of missed out in the first question that you asked me. So every curriculum can be actually designed. We can actually work with every curriculum and tweak it to bring it to bring the child to understand it. The NIOS every curriculum has its own advantages and disadvantages. Just because the question is on NIOS, let me say it is completely parent and child centric. And as facilitators, we can work at the pace of the child, and it gives them room to attempt one exam at a time, two exams at a time. So they get complete subject knowledge before they even attempt. So the exams are not clubbed. The child, when they feel is ready, or the parent feels the child is ready, they can sign in for an exam, take it. So this is extremely good when the board exams, because board exams are such a scare for the children that most of the boards, like whether it's ICSE or CBSE or IGCSE, when it comes to board exams, the children are very, very scared about it. This is a very simple way of saying that when you are ready, you can take the exam. They're on-demand exams as well. So when the child is ready, they can, take this. So NIOS is a board which is very flexible and child-centric and can work at a child's pace. And also the subject choices are so much. So NIOS stands for the National Institute of Open Schooling, for those who don't know that. So that starts with the open basic.
Somebody,
Right. Sorry.
somebody's saying they take in only at 14.
Yes. So there is the before part of it, which is called as open basic schooling, which has the entry at third grade, fifth grade, and the eighth grade exams can be taken. And now the government has also put forward a very nice curriculum for the open basic education as well. So NIO open schooling starts right at third grade. So you could work with your child on a home base. We realize it. So we also have the home management program and a virtual learning where we can help the child and the parent learn, and it's as early as third grade, and so it's not just the board exams. Yeah,
I'm sure many parents will find this information useful. And thank you. And I see Uzma has raised her hand. Uzma, would you like to unmute and ask your question?
Yeah, this is regarding facilities available for non-verbal children. So there's this girl I know who is going to be 15, and she started reading things like anatomy, astronomy, embryology at 7 years of age. But she only uses the tab for communication. So she can do 3 into 3 digit multiplications. But now there's no school who is till 8th standard. She was in a regular school, and they would give MCQs and she would type out her answers, and that was how she was getting promoted. But now we've just hit a wall. So if anybody knows about children like this, it seems NIOS does not have any computer-based exams. So what are the facilities available for non-verbal children is what I wanted to know.
should I take it, Deepa?
Sure.
No, so yes, it is not yet available. They are putting it together. Even CBSE is trying to bring this where you can type your answers. They're trying to bring this in. But K-12 International does have this, K-12 International does have this facility where you can type your answers. But I could double check come back to you, Usma, if you leave your details.
So that would be wonderful. Thank you so much on that.
Yes. Yeah, we can take Sumiti quickly. Can you just give the next question?
Yeah, so I think few questions again related to kids who are non-verbal and what kind of school do we choose for them. So that is one question that parents are coming up with. For a non-verbal child, how do we choose a school?
Should I take it again, Deepa?
And maybe yes.
Maybe Dr. Suhas can answer.
I think he's on a call. Dr. Suhas, would you, sorry. There's a question on how do we choose a school for a non-verbal child?
Sorry?
Any thought on that? How do we choose a school for a child who is non-verbal?
Right. Context of? I mean, is there any context to that question? Like
So they're
generally, how
saying
do
that
you school?
considering that mainstream school is not, the best school for them, what kind of school would be best for a non-verbal child?
Um, I mean, a tough one. No?
Yeah.
I mean, maybe I'll break this into parts. I think definitely the school's attitude towards the child's communication matters more than the infrastructure, because sometimes we see a lot of families opting for schools with a lot of infrastructure, and these are schools who are not AAC ready and do not want to introduce AAC, who have a lot of misconceptions that we'll wait for speech to come, and only after speech comes we should introduce AAC, which is absolutely wrong. So one of my major factors which doesn't get discussed very often is the school's attitude to be able to introduce AAC, work with AAC. I mean, I was just hearing the previous example about this child who was doing really well and using an iPad and all of that, right? One of my first instinctive reactions was, thank God that they've introduced AAC early, which I think makes a huge difference. Yeah. And of course, for other things that for non-verbal children, we say apart from the speech part is, in terms of the teacher to child ratio really matters. A non-verbal child in a class of 30 is going to be much more invisible. So the ratio actually must be a kind one and should allow for individual attention. And I do think that sometimes for non-verbal children in my practice, the sensory environment becomes much more important. And sensory accommodations are literally a very low-hanging fruit. But I see so many times in many schools that that is not accommodated for a quiet corner, or a child being allowed to wear headphones. The lights are too bright, the noise is unbearable, and we have seen nonverbal children have much more difficulties with these sensory environments. I think somewhere I have also felt that sometimes the therapist for these children should be in the school and not after school. That's my opinion. And I think you should choose it based on, you should always go with how the school has treated other non-verbal children. You should always ask the school when you have that initial meeting, do you have children who are non-verbal or minimally verbal? How have you handled them? And you learn a lot from that one simple question, really. And I think that is extremely important. Yeah. So these are my thoughts on that.
Thanks a lot. I think they're very useful. And I'm just going to give one last question and then we're going to wind up. There is, Dr. Suhas, for you, a question on how do I know that my child is emotionally ready for school? You're muted, Dr. Suhas.
Sorry, I was just asking, is that question for me?
Yes, please.
The question is what? Can you tell me again? How is the child emotionally?
How do I know that my child is emotionally? We spoke about academic readiness and emotional readiness. So the question is, what are the signs that tell me that my child is emotionally ready?
Right. I mean, again, a question that I'm learning that there is no straight answers, right? Okay. I think somewhere there is no standardized emotional readiness checklist. That's the first point. These are very, there are, of course, specific capacities that tell you whether a child's sort of is ready. I mean, internal world, you call it, or the emotional, this thing is ready for the school will demand of it. Perhaps, things like separation tolerance. Can the child manage being away from the primary caregiver for some time without any prolonged distress? You look at basic emotional regulation. Can the child come down from a meltdown or a moment of frustration without a lot of adult support or within a reasonable window? Or sometimes even a child is able to come down from it, independently as well. Is the child able to tolerate no? Is the child able to wait rather than getting distress? Generally, is the child able to cope with transitions really well? Because school ultimately is a series of transition. Can the child move from one activity to the other without without each change becoming an emotional crisis? um, uh, one thing I always say is that, can the child be in a group? How does the child do in a group and attend to a shared activity? Or if in terms of the social group, if there's something that doesn't go according to plan, how does that happen? A child's just tolerance for sensory variability as well. So I think these are some of the things that we would use, but more than that, one is emotional readiness of the child, but I also think the emotional readiness of the parent is also very important. And I think if the parent is not emotionally ready for it, it won't happen, right? But there is no checklist for the emotional readiness of a child. These are certain things that immediately come to mind.
Yeah, thanks. Just one sentence on what do you mean by parents being emotionally ready?
Uh, I feel sometimes I have seen an experience in a small subset that the child's emotional readiness is okay, but the parental anxiety sort of sometimes can come in the way and can prevent the child from actually exploring school. The child has been ready, he's been ready for a while, but there is a lot of anxiety around if this happens, if that happens, and then what happens. And sometimes, yeah, that I think is what I meant by parental readiness.
The child starts mirroring that anxiety, right?
Yeah. And anxiety spreads faster than COVID-19. If you have a parent who's anxious, the child's anxiety is going to be up. It spreads like wildfire, and it is. And most times when we see children with anxiety, we do see one or both parents have some anxiety issues as well.
Thank you. And we are going, maybe if the panelists permit, I will allow Pavanam Jainpur to ask a question, and that will be the last for today evening. Uh, Pavanam, would you like to unmute and quickly ask your question? You've been waiting for a long time.
Yeah, am I audible?
Yes, you are audible.
Wonderful. Just one quick small question is because we were talking about non-verbal children, in scenarios where perhaps the understanding is good, the child is able to communicate well through writing, means there is clarity of thoughts, etc. But such children being non-verbal, any specific, I know it's a very generic question, it can go on for long, I do understand that. But considering the experts who are here, any quick pointers on what can be done for non-verbal children? That's the question.
In what context? What can be done in what context?
Yeah. So see, the context is basically that the child is able to understand and communicate well through writing. Speech is not there. Okay. The school is very positive. The atmosphere is very positive. I somehow feel that perhaps, the child also says that I want to talk when he is writing. Writing is there. He's able to communicate his thoughts in through writing. So he says that I want to talk, but and the vocabulary is very nice. The type of language that he writes, the word understanding of words is phenomenal. But conversion into words is not there, or speech is not there. So yeah,
You're talking about the speech output, so I'll take that question.
that's right. Yes.
So we don't really close the window for speech for any child. Uh, okay. At the same time, like everybody says, we introduce alternate methods of communication as early as possible, right from day one. And I'm glad that this child has that opportunity. There are several
Yes.
techniques that we can do to try and promote speech without putting direct pressure on the child to speak, right? So,
Right. Right.
simply put, if there are some sounds that the child can make consistently, can we kind of give them communicative value so that he can use that? It may not be a full word, but it could be a proto word that the child could use, so that there is a specific way of going about that. There may be a certain, a basic speech motor analysis that we would need to do, and then build from there, looking at what the child is capable of. It will be a brick by brick process. It will be, it sounds like he's been nonverbal for a long time, so it will be a long process, a patient process. But we don't close the window for speech. We work systematically supporting him, and sounds to me that you're doing a lot for this child. The fact that he's in school, he's able to participate in school. I mean, kudos to whoever's doing that. Well done. And yes, there are some things that one can try for the speech. I'll leave it at that.
Deepa, can I
Sure,
just
ma'am. I'll
add a
connect with you
point?
later. Please.
Yes, yeah, sure.
Yeah, one of the things that I often see, and I say this a lot, is to always build on the strongest channel of the child and not fixate on the weakest. I mean, rather than spending a lot of years, I mean, of course, I never give up on communication, never ever give up on communication. But I think a lot of time we need to invest in making the existing communication channels more powerful and more accessible. And I think that is a very core cornerstone of improvements as well. And if writing is their voice, brilliant. We should be able to utilize that a lot more. Yeah, but I really do understand the sentiment in which the question was asked, but this is just my technical thought on it, bordering on the philosophical of it.
I get the philosophy, and I totally agree with you on that. That mind switch is extremely important and critical, because speech often surprises us when there is no pressure to speak. So,
Yeah, yeah. I'll connect with you all later. I think
it's a
time is
fine
running. So,
one has to do. And with that,
yeah.
I will thank all the panelists for being here, and the entire audience for your wonderful participation, and lots that we have learned together. And yes, every life has value. That's the message for this year's autism awareness, and together we shall work for that. So thank you and good night.
Thank you.
Thank you.
Thank you.
Thank
I
you.
would request the panelists to stay for a photo session, as well as if the audience can stay for photo session, please. Thank you.
Thank you so much.
Thanks, Smriti. I had not thought of that. So maybe you can take charge and tell us what we need to do.
Just request everybody to turn on their cameras.
Okay.
Thank you so much. Everybody is attentive and listening. Everybody has promptly turned on their cameras. Thank you.
So are we good to go?
Yeah, just the panelists, if they can stay back for a last photo, and then we can just say goodbye. Thank you, everybody.
If any of the panelists have other things to do, please feel free
Yeah,
to.
please feel free to.
No pressure. We appreciate you took out so much time.
Yeah, ma'am. Just I wanted to share one thing which I missed. What Betsy told when she learned that why she is different, she could collect the pieces and she could understand. That is really a very good point, ma'am. Actually, you also once mentioned that you should convey to Sri Sankal that why he is different. So we attempted to do that, ma'am. Actually, that helped. Actually, he calmed down a lot when once he understood why he is different. That really helped, ma'am. That actually at right point we should communicate to the child why they are different. Yeah.
I think that's something that even Dr. Suhas mentioned, how at developmentally appropriate stage, in developmentally appropriate ways, we need to get that message across. Yes.
Yes.
Smriti, I don't want to keep everyone.
Right, I think, yeah. Thank you so much, everybody. It was wonderful having you all.
Yeah. Bye
Thank
bye.
you.
Thank you so
Bye-bye.
much. Thank you. And
Bye.
thank you, Nitya Priya ma'am, for all your wishes.